Okay, good morning, everyone. My name is Amber Archibald. I'd like to start off today by acknowledging with respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanich peoples whose historical relationship with this land continues to this day. I'd also like to note that the organization that I completed my practicum with, they serve a diverse population, including non-binary and transgender people who need contraception. However, the supporting research for my project focused only on cisgender women. So I will be using the term women throughout my presentation, even though this topic is relevant to individuals of all gender identities. So in 1969, contraception was decriminalized in Canada. So this was over 50 years ago, but women still struggle to properly use contraception, and they face many health risks associated with this struggle. So my project was based on improper contraceptive use and its associated public health outcomes. So I had the unique opportunity to work with Island Sexual Health Society and with Dr. Karen Falter, who's on the line today, from the Community Health Equity Research Group at the University of Victoria. So Island Sexual Health is a nonprofit sexual health organization. They were founded in 1969. And they envision a diverse community that celebrates healthy sexuality throughout life. So Island Sexual Health, they also provide the community with a variety of sexual health education programs. Some of these are access and education to contraception, STI care and support, and school and university sexual health education. So one of Island Sexual Health Society's program is the Birth Control Educator program, which was the focus of my project. So this program is birth control education sessions. They're based on peer education. The birth control educators provide patients with accurate facts about birth control. So this might include the types of birth control available, any misconceptions or side effects, as well as how to use the birth control. Overall, the birth control educators aid patients with informed decision-making about birth control. These appointments are all conducted by volunteers who have received training from Island Sexual Health, and they're booked in conjunction with doctor appointments so that patients can receive any prescriptions that they might need and have any medical questions addressed. So Dr. Falter was conducting a program evaluation of the birth control related programs at Island Sexual Health Society, but the purpose of my project was to compose a section of the program evaluation report, which was looking just at the birth control educator's role. While doing my project, I looked at 3 different questions. So these are, does the birth control educator program use a reproductive justice concept? And I will talk about reproductive justice in a moment here. I also looked at how and does it connect through a reproductive justice through reproductive justice to contraceptive adherence. And why is adherence to contraception important? So before I talk about reproductive justice, I wanted to look at the reasons for a lack of contraceptive adherence. So improper or inconsistent use of contraception is common, such as forgetting to take a daily birth control pill or having the patch fall off. So according to a 2009 Canadian survey by Black and others, 35% of women on contraception did not use it consistently. So there are many reasons for improper use of birth control, but 3 here that were relevant to my project are the degree of information provided to patients, understanding instructions for use, and the knowledge level of patients. These 3 reasons are centered on education, which is a core part of the birth control educator program, making them relevant to my project. So they were the main ones that I looked at. To answer my project's questions, I needed to understand how contraceptive use affects public health. So this can be seen in one way through unintended pregnancies, which have many health impacts. In the United States, 50% of unintended pregnancies are due to improper or inconsistent use of contraception. We can define unintended pregnancies as either mistimed or undesired, but it's important to keep in mind that they're not always unwanted. In Canada, 40% of pregnancies are unintended. So here, I focused on unintended pregnancies in youth because unintended pregnancies are significantly higher in women under 25 years of age, and they are connected to multiple health risks. Also, the birth control educators often worked with this younger demographic. So youth pregnancies can result in a higher risk of postpartum depression and premature infants. There can also be poorer maternal education and lower socioeconomic families. So maternal education and the socioeconomic standings of the families are also linked to economic output. And so in these situations, sometimes the output in the economy can be decreased. Further, there are associated costs to unintended pregnancies due to improper use of contraception. Just in general, for every dollar spent on contraceptives, 7 are saved. But in Canada, 34 million per year can be saved through proper use of contraception. So not only can adherence play a role in reducing unintended pregnancies and the health risks attached to them, but adherence can save the country millions of dollars. So I've mentioned reproductive justice a number of times, but I'm going to explain what it is now. So it's a philosophy that can be used in birth control counseling that can address the reasons for improper or inconsistent use of birth control, which I went over the 3 main ones that I was looking at. It's an approach to sexual and reproductive equity that is human rights and justice-based. It is non-biased and open manner. It promotes client decision-making, and it can provide information when it's used in birth control counseling. So reproductive justice, however, is not always used. The literature has shown that many minority groups have been pressured into making birth control choices that have resulted in discontinuation or improper use of their chosen method. As stated earlier, 35% of Canadian women on contraceptive use it inconsistently. So this lack of consistency implies that the reproductive justice could be better utilized in Canada. So although there were other methods involved in my entire in the entire program evaluation, and we had ethics approval, my project looked at 3 main points: a literature review, writing the report, and the thematic analysis of the transcribed birth control educator interviews, which is what we're looking at here. So from this analysis, 4 indicators were found that imply the use of reproductive justice approach through the birth control educators. These were that the birth control educators provide space, time, and a comfortable and safe environment. They provide an equal playing field, so the power dynamics between the birth control educators and patients were seen as more equal than between the medical staff and the patients. The birth control educators also consider individuality and the lifestyle of the patients, and they promote patient-led and informed decision-making. So one of the birth control educators explained it as a collaborative discussion where the patient totally drove. Just a note, while considering these results, it's important to know that my piece of the project only focused on birth control educator perspectives and did not include patient or staff perspectives. So the birth control educators addressed the indicators for improper use of contraception. These were the degree of information supplied, understanding instructions for use, and the knowledge level of patients. They do this by providing time to ask questions and absorb information, providing equal power dynamics, providing thorough information, and promoting decision-making that is patient-led and based on individual lifestyle. These points are also all aspects of a reproductive justice approach. So in conclusion, this shows that the birth control educator program is in alignment with a reproductive justice philosophy, and it is well suited to promote adherence to contraception. In turn, it can affect the rate of unintended pregnancies, their associated individual and public health risks, and the birth control educator program can even contribute to the achievement of equity. This information has the potential to help inform individual, organizational, and national birth control counseling practices and policies. So even though it has been over 50 years since contraception was decriminalized, the struggle to use contraception properly and the health risks associated are still present. Island Sexual Health Society, through the Birth Control Educator Program, is one organization that has the potential to ease this struggle. So before I end, I just wanted to take a quick moment to thank Island Sexual Health, the staff there, and Dr. Karen Falter for giving me a rich practicum and helping me on this journey, as well as thanking my friend and mentor, Dr. Richard Vierpin, and my parents and my partner, Kieran, for supporting me as well. Thank you.
That's great, Amber. Thank you. That was a fascinating presentation. That really was, I love that last slide. What a great illustration. Actually, before anyone jumps in, I have to admit I was absolutely flabbergasted when you said that the contraception was only decriminalized, as recently as 1969. How does that compare to other jurisdictions? You turned your microphone off. Can you turn your microphone back on, Amber? Can't hear you.
Yes, sorry about that. My research was actually just focused on Canada, so I don't currently have that answer for other areas. But it would be really interesting to look into that and see what the variation in different countries is.